95% of my subscribers are men, and the majority of them are between the age of 25 and 34. So I thought about what you guys might be the most curious about, and I have prepared this video. Many men assume that pregnancy is not possible during menstruation and they don't use any protection, or they wonder whether it's truly impossible to get pregnant during that time. That's why I made this series. This will be of 4 videos, and today's topic is, can you get pregnant during your period? And the next one will cover how period sex affect the body, how to have sex during the menstruation, and what to be cautious about. And I will divide them into for men and for women. And the last one will be about the whether circumcision affects the sexual sensitivity. So please subscribe and let's get started. We are going to fact check the chance of pregnancy during period sex under different scenarios. As you all know, for pregnancy to occur, a sperm and an egg need to meet. Since there is no egg during the menstruation, some people assume pregnancy is not possible and don't use protection. But then a surprise baby can happen, right? Why is that? In a typical menstrual cycle, ovulation happens on day 14, counting from the first day of your period. So, the closer you are to the ovulation day, the higher the chance of the pregnancy. And the farther away, the lower the chances. But even if you have a regular cycle, ovulation doesn't always happen on the exact same day. It's a probability. It can happen a day earlier or a day later, or even 2 days earlier or later, because our bodies are not machines. That means ovulation might not happen exactly on day 14. It could happen right after your period end. And in that case, having sex during your period could lead to pregnancy. So, who is most at risk? First, people with irregular menstrual cycle. Second, people with short cycle. For example, those who have a 23-day cycle instead of a standard 28 days. Third, those who have period that lasts longer than 7 days. If you fall into one of these categories, you should still use contraceptive during your period. Now, let me explain why. First, let's talk about the most fertile days, okay? Once inside a woman's body, sperm can survive for about 3 to 5 days. Studies show that if you have sex on ovulation day or up to 5 days before, the chance of conception increase significantly. That's why knowing your ovulation day is crucial. I mentioned earlier that ovulation typically happens on day 14, right? But in reality, that only happens about 20% of the time. Many times, ovulation happens on the 3 days earlier or later than expected. But if you have a strict 28-day cycle and your period lasts only 5 days, then even if your ovulation happens earlier, the chance of pregnancy are still low. Not zero, but really low. You need to focus from here. However, for those with short or irregular menstrual cycle, the situation is different. Let me explain using a chart. For example, for those with a 23-day cycle, the probability of ovulation occurring between day 7 and day 10 is about 14%. When your cycle is short like this, the end of your period and the day your egg is released can be very close together. And if your cycle is irregular, there is a higher chance that ovulation could happen much earlier than expected. That's why people with a short or irregular cycle can get pregnant from having sex during their period. Also, for these individuals, the chance of pregnancy are much higher if they have sex towards the end of the period rather than at the beginning of their period. For those with long cycle, if their period lasts 7 days or more and they have sex towards the end of the period, sperm could still survive until ovulation if ovulation happened earlier than expected. Because ovulation can always happen earlier than predicted, this is very important. So please remember this. Now, if you're feeling anxious because your period hasn't started yet, let me tell you the most reliable way to check when you ovulate, so you can do the math and check the possibility. There are apps and ovulation tests, but the most accurate way to know would be the ovulation fluid. I thought that all women knew what the ovulation fluid is, but surprisingly, I would say only 30 to 40% knew when I asked about the ovulation fluid to my patient. Anyways, it's a clear, white egg yolk kind of fluid, no smell and sticky. So if you see that around day 14, that's the day that the egg was released. If you want to know when the best time to have sex for pregnancy is, leave a comment and I will make a video about that too. Of course, right after your period ends, your uterus is not in the most ideal state for pregnancy, but pregnancy can still happen. Let me summarize everything for you. The thing that you must remember is ovulation can happen earlier than expected. So first, if your cycle is irregular, second, if your cycle is short, and the third, if your period lasts longer than 7 days, you should still use protection even during your period. In the next video, I will talk about how period sex affect the body, how to have sex during menstruation, and what to be cautious about. And 97% of you who watches my video don't subscribe. So please don't forget to hit the like and subscribe, and I'll keep posting useful information. And remember, health is wealth, so invest in yourself. This is Dr. Sean, making health easy for you. See you next time.